Hello and welcome to this sample virtual diabetes education class. My name is Quisha Umemba and I'm excited to be able to share this information with you. Hopefully you visited our booth in the exhibit hall. If not, I invite you to go ahead and check out an overview video of our virtual diabetes education class that will actually give you a brief overview of the entire program in its entirety and what we cover in every session. For this sample class, we're going to be using the conversation map that discusses how you manage diabetes long-term to prevent complications. And this is what that map looks like. In this particular session, the things that we review include a review of the natural course of diabetes, reducing the long-term complications of diabetes by reducing diabetes risk. We talk about how to keep your blood sugar on target. We talk about diabetes medications and how they work in your body. And we talk about some of the basics of insulin and the different types of insulin. And as always, every week we set goals that set you up for success to help you better manage your diabetes. Let's start by focusing on the left side of the map visual at the people walking on the bridge and discuss a couple of general questions. How long ago were you diagnosed with diabetes? Chances are you remember the day you were told that you have diabetes, and I'm sure you have emotions that are evoked when you think about everything that you were told on that day. How have things changed since your initial diagnosis? Are you more confident in your ability to live and thrive with diabetes? Do you find it more difficult? Are you frustrated, angry, upset? Or maybe you're one of those people that feels like diabetes really saved your life. And although it can be looked at as a negative, it's been a positive because you've been able to make so many healthy changes in your life over time. Well, diabetes is a lifelong disease. And as your body changes, it can become harder to keep your blood sugar within your target range. I wonder if you found this to be the case. One of the things that I always tell my patients is that over time, your diabetes, regardless of what you do, can get worse. And this is something, especially if you're newly diagnosed with diabetes, that you need to hear sooner than later. You can be the perfect patient. You can, eat all of the right foods and do all of the right exercises and basically be an ideal person with diabetes. And because of this natural course of diabetes, you can still find it harder to manage your blood sugars. In type 2 diabetes, there is a gradual loss of beta cells, and beta cells are the cells in our pancreas that make insulin. Over time, there's not enough of these cells to meet the insulin needs of the body and to keep blood sugar in the target range. So again, doesn't matter if you're the ideal patient, if you're perfect with your diabetes, this could happen to you if you live long enough. Reducing your risk of long-term complications is an important reason to try and keep your blood sugar within your target range. Recognizing the signs and symptoms of high and low blood sugar can be helpful when trying to keep within your target range. You can also think of these signs and symptoms as the short-term complications of high and low blood sugar. So we're going to look at some of these possible signs and symptoms of high and low blood sugar by diving into the storm clouds in the upper left corner of the map, where there are a couple of hot air balloons. So we're going to start with the orange hot air balloon and reveal the signs and symptoms, or the signs rather, of high blood sugar. And some of those things that you may or may not have experienced include increased urination, thirst, dry skin and mouth, blurred vision, a cut or sore that won't heal, or lack of energy. Now, looking at the pink hot air balloon, we see that the signs of low blood sugar, and there are many, include sweating, weakness, hunger, anxiety, being shaky. Maybe you're irritable, not able to think clearly, have a headache, feeling drowsy, numbness or tingling around the lips, confusion or seizure. A lot of times when people have low blood sugar, they can be mistaken as being intoxicated or having drank too much alcohol. I have a sister that I always mess with that I tell her she's acting like the guy on the Snickers commercial whenever her blood sugar is low because she gets hungry and shaky and angry and just kind of cranky and moody. All of those are symptoms of low blood sugar. Um, for many people with diabetes, they don't always know when their blood sugar is out of range by the way they feel. So, for many, the only way to know for sure is by checking or monitoring your blood sugar. So, now let's continue by focusing on the things that you can do to keep your blood sugar in your target range, even with the natural course of diabetes. Healthy eating and keeping active are always key to keeping your blood sugar in the target range. What experiences have you had when it comes to trying to eat healthy and be active? It's important for you to keep in mind not only what you eat, but how much you eat and when you eat. And when it comes to keeping active, make sure that you sit less and move more. It's that simple. And I think a lot of the times we make it harder than it has to be, but really just starting here with these basics, okay? Sometimes it can be difficult to add physical activity into your life when you have chronic pain or some other kind of physical limitation, but that doesn't have to be a barrier to getting in some physical activity. Most of us will fall somewhere along this spectrum in terms of how we feel about physical activity, but there are lots of activities that you can do if you feel limited by pain or other conditions. So I'm going to talk to you about those right now. Tennis, biking, jogging, Tai Chi, walking, dancing, or light aerobics. You can ride a stationary bicycle, or you can have fun, golf, water aerobics, swimming laps. A lot of times we look at exercise as that exercise, but it could just be moving your body, lifting weights, chair yoga, balance exercise, even walking or marching in place, which I've done quite a bit of using my Fitbit when I'm trying to get in my steps, or especially if I'm in some type of Fitbit challenge with others. There's so many ways that you can participate in being active. In addition to healthy eating and physical activity, taking your medications is also a key aspect to managing your diabetes. There are different types of diabetes medications that work in different areas of the body. We're going to talk about how diabetes medications work on the body. There are certain medications that work in the brain and the nervous system to increase metabolism and your sensitivity to insulin. There are certain medications that work in the liver, where they slow the production and the release of glucose or sugar so that you need less insulin. There are certain medications that work in the kidneys, and these medications work by blocking glucose or sugar from being reabsorbed in the kidneys, which means that more glucose is removed from the body and then it's excreted through urine. There is some medication that works by stimulating the pancreas so that your body makes more insulin, decreasing the amount that you need from taking outside injections or exogenous injections. There are some medications that work in the intestines and in the stomach to delay the breakdown of carbohydrates, so bread, pasta, etc. And these medications reduce the peak of blood sugar after eating. So it helps so that your blood sugars don't rise as much after you eat your meals. And lastly, there are certain medications that work by increasing insulin sensitivity in your muscle tissue so that glucose, again, sugar, can be absorbed better there. Now, if we were in a live session, I would be asking you if you have questions about any of those, because these are the type of things that we talk about in our live virtual diabetes education program. But since we're not live, I'm going to skip over those conversation prompts and finish the rest of this session so that you have a better idea of what to expect in our course. As mentioned earlier, we're talking about the natural course or progression of diabetes. And as time goes on, remember your pancreas, it may no longer be able to keep up with your need for insulin. And that's why many times, oftentimes, people with diabetes eventually need to take insulin. So for those of you that may be wondering, okay, I don't understand why I need insulin anyway, or the importance of insulin to keeping my blood sugar lowered, let's talk a little bit about that. Let's take a look at the general definition of insulin. Insulin is a hormone that is made by the beta cells in the pancreas, and the beta cells are what release insulin to help the body use or store sugar from food. Now, normally, when the pancreas is able to function normally, it releases insulin appropriately to match the levels of glucose in the blood. As we discussed earlier, sometimes the pancreas is no longer able to make insulin. And so when that happens, a person with diabetes needs to take insulin to ensure that the body has enough to maintain target glucose levels. Medications are likely to play an ongoing role in helping manage your diabetes. And for most people, the medications they take tend to change over time based on what is happening in their bodies and what will best help them. Also, it's common for people to take more than one medication at the same time to help them effectively manage their blood sugar. So again, don't look at that as a failure either. Over time and with the natural progression of diabetes, this is something that could occur. So that's the end of our diabetes education class sample. I hope you found the information in this session helpful. And again, if you'd like to find out more about our virtual diabetes education program, please go and visit our booth during the summit and watch the overview video, which goes step by step over the topics discussed in all of the 8 modules or lessons that we review in our program. If you have any questions at any time, you can email us at programs@diversityindiabetes.org. Thank you so much for watching. Enjoy the summit.